in YouTube live. Yeah. So before we start, so this talk will be streamed to YouTube live. So this is for my announcement. Thank you.
Prof. Ari, excuse me.
Yeah.
More louder, please. Louder,
yeah.
please.
Yes.
Your sound.
Oh, my sound.
Yes. Louder, please.
Okay. Now, this. Yeah.
Yes, enough.
Okay. Yeah.
Buka ini semua nih.
Bu Nadia sudah. Morning, Miss Nadia.
Ininya diaktifkan ya.
Bu Retno sudah hadir ya.
Sudah hadir semua.
Sudah
ya?
hadir semua ya.
Bu Kerry yang belum hadir. Panelis satu lagi.
Bu Kerry.
You will already live on YouTube channel.
Yeah. Yes. Yeah, you can start the channel.
Okay, it's already.
It's already started.
Okay.
Yes. Pakai ginian nih.
Nanti Ibu lepas aja.
Oh, Bu Kerry belum bisa masuk ya?
Kenapa?
Kita jauh-jauhan. Iya, kita jauh-jauhan. Kalau saya mau gabung, ke YouTube, Bu. Oh, yang linknya sudah di-share di grup dosen oleh Pak Ari.
Ya. Mbak kumaha atuh, Mbak mau masuk? Mbak mau masuk? Masuk aja.
Udah 510.
Assalamualaikum.
Assalamualaikum. Bu Retno.
Bu Retno tadi muncul.
Ya.
Oke, baik. Ya, terima kasih ya.
Prof. Kerry ada itu.
Ya.
Prof. Kerry sudah muncul.
Ya. Assalamualaikum, Bu Kerry, Prof. Kerry ya. Tinggal Bu Retno ya. Bu Retno sudah hadir?
Bu Retno sudah muncul. Sudah ada tadi saya lihat.
Pak Umi, apa kabar?
Alhamdulillah Prof. Kerry. Wah, makin seger aja ya.
Pak Umi juga makin seger, Pak Mahdi.
Oh iya.
Terima
Bapak
kasih
Ibu,
undangannya.
Kita mulai saja atau seperti apa?
Ya,
saya nunggu instruksi ya.
Ya, silakan. 13:05.
Dimulai saja ya, Pak.
Sudah bisa mulai, sudah lengkap semua ya yang hadir. Peserta, speaker dan udah siap. Saya.
Baik, mungkin bisa kita mulai ya. Good afternoon, ladies and gentlemen. We kindly invite all of you to stay in your Zoom schedule for the webinar because the event is going to start. We also recommend to all guests, panelists, and participants to mute your Zoom's microphone in order to avoid the noise during the webinar. To our honorable guests, Dean Faculty of Pharmacy Universitas Indonesia, Dr. Apoteker Mahdi Yusfri, Master of Science, Vice Dean Faculty of Pharmacy Universitas Indonesia, Profesor Dr. Apoteker Ari Yanuar, Master of Science, and Profesor Dr. Apoteker Abdul Monem, Master of Science. The honorable distinguished speakers of the webinar, Profesor Dr. Apoteker Retnosari Andrajati, Master of Science, Associate Profesor Dr. Muhammad Makmur Bakri, Professor Michael Scott, Mrs. Diane Gill. The honorable panelists of the webinar, Profesor Dr. Apoteker Umi Atiyah, Master of Science, Profesor Dr. Apoteker Agung Endro Nugroho, Dr. Apoteker Rina Mutiara, Master of Pharmacy, and all of the participants. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon and welcome to International Webinar of Faculty of Pharmacy Universitas Indonesia with topic The Role of Pharmacists During COVID-19 Pandemic. My name is Larasati Arum Kusumawardani, lecturer from Faculty of Pharmacy Universitas Indonesia, will be your Master of Ceremony and moderator for this event. Ladies and gentlemen, we are delighted to inform you our today's agenda. So for the first one, There will be opening remark from Dean Faculty of Pharmacy, Universitas Indonesia, Dr. Apoteker Mahdi Jufri, Master of Science. And after that, we will have lecture and sharing session by our speakers, Professor Dr. Apoteker Retnosari Andrajati, and Associate Professor Dr. Muhammad Makmur Bakri for the first and second session. The next lecture and sharing session then will be given by Professor Michael Scott and Mrs. Diane Gill. After the lecture session, there would be 2 discussion sessions that consist of panel discussion from our distinguished panelists and continue with the participant discussion. On the last, after closing, there will be closing and also post-test quiz for the audience. Okay, before we start, there are some information for you to know. The first one, the audience will be able to get certificate with SKP credits from Ikatan Apoteker Indonesia if taking exam with score at least 80% in post-test. This webinar also can be accessed on YouTube via live streaming, but the YouTube participant will not be able to get the certificate. Besides of that, I want to announce that there will be 3 door prizes that will be given to so for the participant, please stay tuned. Ladies and gentlemen, now I would like to invite Dr. Apoteker Mahdi Jufri, Master of Science Apoteker, as Dean Faculty of Pharmacy Universitas Indonesia to deliver the opening remarks. To Dr. Apoteker Mahdi Jufri, please give the speech. The time is yours.
Thank you, Moderator Ibu Laras. Assalamualaikum warahmatullahi wabarakatuh. And good afternoon for Jakarta and also Kuala Lumpur, and also for Michael Scott and Diane and Ibu Nadia, good morning, for the Belfast, UK. Honorable to all speakers, Prof. Michael Scott, Director of Medicine of Optimization Innovation Center, Belfast, UK. Mrs. Diane Gill, Assistant Director of Pharmacy, Clinical Service, Belfast, UK. Associate Professor Muhammad Makmur Bakri, Dean Faculty of University Kebangsaan Malaysia, Kuala Lumpur. Professor Dr. Retnosari Andrajati, Apoteker, Lecturer of Faculty of Pharmacy, University of Indonesia, and Head of Installation Pharmacy of University Indonesia Hospital, Depok, West Java. I'll introduce, she's a new professor in Faculty of Pharmacy, and her decree letter from Minister of Higher Education came last week. Maybe we can applause. Also honorable to all panelists, Professor Dr. Umi Atiyah, Apoteker, Dean of Faculty of Pharmacy, Universitas Airlangga, Surabaya, and also representative of the National Pharmacy Board of Republic of Indonesia, Professor Dr. Kerry, MS Apoteker, Vice Rector Unpad University, and representative of the Task Force of COVID-19 of Indonesian Pharmacy Association, or EAI. Professor Agung Endro Nugroho, Master Apoteker, Dean of Faculty of Pharmacy of UGM, Gajah Mada, Yogyakarta, and as a representative of Indonesia Pharmacy Higher Education. And also Dr. Rina Mutiara, Magister Pharm Apoteker, Head of the Installation Pharmacy, Department of Pharmacy, Rumah Sakit Cipto Hospital, Jakarta. And also to the audience, more than 2,000 with the Zoom and YouTube. Welcome to the second webinar of Faculty of Pharmacy in Indonesia. Ladies and gentlemen, as we know, since the outbreak of coronavirus occurred first in Wuhan, province of Hubei, China, last December 2019, and the virus spread to all over the world, and the WHO in February was declared the pandemic of COVID-19. Until now, more than 3.2 million people was infected and more than 250,000 people dead. In the meantime, no medicine to treat and vaccine to prevent this COVID-19. As health provider, such as medical doctor, nurse, and pharmacist must work hand in hand to cope this pandemic, especially in hospital. Pharmacy professionals are performing frontline roles Community pharmacists and their teams are a vital healthcare provider during the outbreak. They remain on the front line in public health and serving the direct point of access to their patient. Hospital pharmacists have an important role during the outbreak in the infection control as well as patient care and subject support. Community pharmacists also continue to play their role toward public uninterrupted for regular supplies of medicine, as well as supporting government for disseminating information on precaution related to COVID-19 spread, including hand washing, technique in availability of face masks, and instruction for their proper use and disposal. Pharmacists are also working to providing home delivery, as well as dealing with the increasing number of patients coming through the pharmacies with the other ailments. This international webinar will be aimed to share experience how pharmacists profession in UK, Malaysia, and Indonesia working together hand in hand with medical doctor and nurse as frontline to take care of the COVID-19 patient. As I did, I will thanks to all speakers and panelists who participate in this webinar, and also to all participants and webinar which reached almost 2,000 participants. And last but not least, thanks to all committee who are working hard to provide this webinar only 2 weeks. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Okay, thank you, Dr. Apoteker Mahdi Jufri, for the opening speech. So, ladies and gentlemen, before we answer the first sharing session, I would like to invite all of the speakers and also the panelists to open your video cam in Zoom application for the screenshot photo documentation. For the committee, please help us to take the photo. One, two, three. Okay, is it enough? Yeah, enough. Okay, I think it's enough. Okay, thank you very much. Now, because we will start our lecture and panel session, we would like to ask all of the panelists who don't interact in speaking to turn off your camera in order to make it more focused. So, next start the first session, we would like to invite Professor Dr. Apoteker Retno Sari Andrajati, Master of Science, to give lecture and sharing session for around 20 minutes about the pharmacy practice in Universitas Indonesia Hospital as a COVID-19 referral hospital in Depok, West Java. Professor Dr. Apoteker Retno Sari Andrajati, Master of Science, obtained her undergraduate degree and pharmacist from University of Indonesia, Master of Science in Pharmacology from Institute Technology of Bandung, and PhD in Clinical Pharmacy from Charles University, Czech Republic. Since 1998, Professor Retno joined Pharmacy Department, and now she's Professor in Clinical Pharmacy Laboratory of Faculty Pharmacy Universitas Indonesia. Besides lecturing and researching, Professor Retno also works as Head of Pharmacy Installation in University Indonesia Hospital or Rumah Sakit Universitas Indonesia. For Professor Dr. Apoteker Retno Sari Andrajati, the time is yours.
Thank you for the time. Mana dia? Udah mulai? Saya udah bisa mulai?
Sudah, silakan Bu.
Silakan.
Silakan Prof.
Okay. I will talk about the pharmacy practice in University Indonesia Hospitals as a COVID-19 referral hospital. So before that, thank you for the opportunity to talk with other and Assalamualaikum warahmatullahi wabarakatuh. Selamat siang, good morning, and Belfast maybe. I've been there 2 years ago, Belfast. Oke, ini keduanya gimana? Terusnya?
Saya langsung di next aja. Oh, koneksinya sepertinya.
Sorry, the connection is interrupt. Gak mau ya?
Iya, ulang aja mungkin yang sebelumnya.
Kamu?
Mungkin bisa di end screen dulu, Bu. Saya minta yang lain untuk share.
End screen-nya mana?
Yeah. Okay.
Okay. Can we start?
Yeah.
Yeah.
Okay. Yes, can start.
Ini 2020 masih 2019. Okay. We will start with this scam of the patient since April. Every patient who come to hospital, they should go to the screening area, and after the screening, they divide it in the third group. The green one patient, they can go to directly to the polyclinics at the hospital, and the yellow one, they can only go to the infectious clinics. The infectious clinic is outside of the hospital, I think in the area of parking. And the red one of the patient, they should go to the emergency department. So we have two part of the emergency in our hospital. There are COVID area, the red area of emergency, and the others is for the green and the green area of emergency. So the red patient, they have to go to the COVID area of Department of Emergency, and then they can assess, and if they need, they send the patient to the inpatient care of the COVID inpatient care. Okay, and now we can go to the pharmacy responsibility. Here, the pharmacy responsibility in the era of the COVID-19 is for the availability and quality of personal protective equipment. Maybe it's different. Maybe in outside of Indonesia, maybe pharmacy only have responsibility to the medicine, but in Indonesia, the pharmacy department also have a responsibility for the personal protective equipment or PPE, medical device as well. And for the outpatient care and emergency care and inpatient care in our hospital. And first, for the availability and quality of personal protective equipment, as the regular rule of the PPE availability is now is low, yeah, is deficit, I think, and the quality, I think, is we don't know the quality because sometimes we don't have we don't have the PPE who has the right quality, and the price increase maybe sometime until twice as usual. But we also have the donation, and this is enough, I think, donation. So the availability increase, but we have a question about the quality. We can check to the website of the Ministry of Health, but usually they don't have the number of administration in our health ministry. Okay. Also, the donation is sometime we have to check the quality, especially for the masker and also for the hazmat suit. Yeah. Slide. Okay. So we need for the doctor or for the nurse and for the pharmacist as well, we need for the PPE on the surgical gown, coverall. Yeah, we have a lot of coverall donation, but the quality is still a big questions. And also apron, hand gloves, shoe cover, surgical mask. And another problem is for the respiratory mask, N95. Okay. Many of donators give us the respiratory mask as key N95, but the nurse and the doctor usually do not want to use this mask because the mask is, I think, still in the questions in quality. Okay, lanjut. Next. Okay. And we go to the next discussion about the availability and quality of medicine. Okay. In our country, we have several programs, and two of the program is avian flu and malaria, and we know that the oseltamivir and chloroquine is two medicine who also use or give to the COVID-19 patients. And we also have donation for the pharmaceutical industry, hydroxychloroquine, because hydroxychloroquine is not the program or the medicine program, but we have to buy, and sometimes we buy if we don't have a donation for this medicine. And for the regular, we have to buy to the distributor is azithromycin, levofloxacin, meropenem, tocilizumab, and vitamin C. Because no program for this drug and also no donation also. In Indonesia, we know that there are two other medicine who give to the patient. The of this is favipiravir and remdesivir, but both of the medicine is only we can get only under the clinical trial. So in our hospital, we don't have both of these medicine. Next. Okay. Now we can go to the outpatient care. There are a lot of changes in the outpatient care in our hospital. We already use the electronic prescribing before the COVID time, but after that we can still use this, but with the other several kind of the outpatient care. First is in the yellow patient. I said before that in the COVID area, the pharmacy personnel also use the PPE as well as the others of personnel as medical doctor or nurse, yeah, because this is the area of COVID. Okay, and we give the screening for the prescription from the prescriber, and the prescriber there is not only for the specialist, but also for the others doctors, yeah. And we dispense and we labeling, and we also give information to the patient as usual. So there is no changes in the pharmacy outpatient care. Only we use the PPE for the when we give the care. Yeah. Okay. Next, this is the first time we our hospital built the tenda itu apa ya? Temporary place for the screening patient, and for the after that we divide the patient to three kind of the patient regarding the COVID-19. Okay, but now we use another building for this, so we not already use this area. Okay, next. The second outpatient care, another line, is the for regular. So the patient, remember the first my first presentation, that the patient divided into three type of the patient. One is the red one. This go to the red area emergency department, and the yellow we give care in the another building outside of the hospital, and the green patient, they can come in to the building, to the hospital building as usual, to the polyclinic, and see to the doctor, and also as the and the pharmacy give the care for this patient as usual, as before we don't have the problem of the COVID-19. Okay. We use the prescribing as usual, and we screen and reconciliation with when we need the patient transferred to be inpatient, and dispensing, labeling as usual, administration, and give the information. And the pharmacy use only the surgical mask, and sometimes if need, they can use the face shield or Google. Okay. Next. And the third, we start with the telemedicine for the outpatient care, and now the patient who use the telemedicine is increased, I think double, and the care for the usual care, I think decrease. I think because the patient may be afraid to go to the hospital. So telemedicine, the patient, they can talk or with the doctor through the online computer, and they can talk with the computer, I think. And after that, the doctor send to pharmacy a prescribing, and we call the patient by phone, by handphone, by handphone, and we talk to the patient after we screen the prescription. And we talk to the patient if they need, they agree to buy the medicine from us or not. Okay. And when we and they agree, we give information about the medicine, and we dispensing, and after that we send the medicine by online taxi buy. Okay. Now we talk about the pharmacy emergency. This is at 24 hours. And for the outpatient, we only give service from 8 o'clock until 9 o'clock. 9 o'clock at night, I think 9 o'clock or 8 o'clock, but usually at 6 o'clock afternoon, the patient is already finished, already. Okay. So in the pharmacy emergency, this is the 24-hour service. As regular, we screen and prescribe, and also we get reconciliation when the patient need transfer to inpatient ward. Okay, and we dispense, we label as usual. And before that, we already talked that the pharmacy, the emergency, we divided two areas. One is the infection area for COVID patient, and the other is the green one is for non-COVID patient. For the COVID patient, we also give the similar services, yeah, and we also in the pharmacy, in the emergency department, sorry, not in the pharmacy emergency, but the emergency department, we have the one room for the operation room. So before that, we use this for the emergency patient, but now we operate this operation room special for the COVID patient. Next. Now we go to the inpatient care. There are separate floor care for the COVID and non-COVID patient. So we talk for the COVID patient. Now we have 30 beds for the patient, and this day we will expand in progress, maybe in this week, for the other maybe 15 beds more, yeah, for this COVID patient. We also have the intensive care unit, high care unit, and pediatric intensive care unit for the COVID patient. Next. For the inpatient care, as usual, we screening the electronic prescribing from the prescriber. We also do the reconciliation for the patient before they change, yeah, or they change for the from the emergency care to the inpatient care, or for the outpatient care to the inpatient care. Okay, and we dispense the medicine as daily dose, and also we do the reconstitution for the parenteral medicine. As usual, then we distribute to nurse after labeling, and we only visit the patient in the special case for the this time, yeah, for the era of the KPK, and but we still monitoring the result of their medicine, yeah, and also we still do counseling when the patient discharged from the hospital. Next. So I think is enough for me for talk about our hospital activity in the COVID era. So we can give the lesson learned for this, that the problem is in the availability of PPE, and especially for the N95 mask, respiratory mask, and also for medicine, who the most we have a problem in the medicine is for the azithromycin parenteral injection, and the other is okay, I think. And we also makes stress in the quality of PPE donation. How to check? Usually we check with the spray and spray for the aqua distillate spray, just to check for the hazmat. And for the mask and 1995 respiratory mask, we reusable in the CSSD Central Sterilisation Unit for 5 times, but only for N95, but not for the key N95. Okay. And I think the medicine shortage, we just talk that's usually for the hydroxychloroquine and also for the azithromycin. Okay. And we still don't know the drug or medicine that can use or give and recover patient from the COVID-19. So they are still in the under clinical trial. So I think it's similar in the other country, and we still don't have the vaccine as well. Yeah. So we need to learn or to hard work for know which the medicine can use for the COVID-19 treatment and also for get the vaccine for the COVID-19. So we have increasing in the workload with COVID pandemic, but grateful. We have a lot of volunteer from the staff of pharmacy faculty from our university and also from the students, pharmacy student of University Indonesia. So it's about 7 staff and about 10 students who work as volunteer in our hospital. So thank you for your attention, and I can give this to the
Okay, thank you very much, Professor Retno, for the sharing session. It is very nice. And then next, we would like to invite our second speakers, Associate Professor Dr. Muhammad Makmur Bakri, to give around 30 minutes sharing session about the COVID-19 in pharmacies in Malaysia. Associate Professor Dr. Muhammad Makmur Bakri take his bachelor and master degree in Malaysia and finish his doctoral study at University of Glasgow, Scotland, United Kingdom. Now, he works as Dean and Associate Professor in Faculty of Pharmacy, University Kebangsaan Malaysia, or UKM, with specialization in clinical pharmacy and pharmacy practice. He has written more than 50 international papers and achieved some teaching awards from UKM and Minister of Higher Education Malaysia. So, please welcome Associate Professor Dr. Muhammad Makmur Bakri. The screen is yours. Good afternoon, Professor Muhammad Makmur Bakri.
Good afternoon.
Okay.
Hi, good afternoon. Can you hear me?
Good afternoon. Yes, I can hear you. So it's time for you to give the sharing session. Okay. Time is yours, Professor.
Okay. Someone will help me with my slides, right?
Yes, someone will help you with the slides. The committee.
Okay. All right. First of all, thank you to the chairperson. Thank you to Faculty of Pharmacy UI to include me in this webinar. Okay, what I will share today is regarding what we as a pharmacist that we do in Malaysia regarding COVID-19.
Yang kelihatannya huru hara berantakannya, Mas.
Siap. Can we go to the next slide? Okay, so what I will share with you is COVID-19 in Malaysia. Then we'll talk about COVID-19 in UKM hospital. Then I will introduce you value-added services that we have in Malaysia, throughout Malaysia. Then what are the new things that we do in UKM hospital regarding these value-added services? Then we are looking at other supports that provided by the pharmacists. Next slide, please. Okay, so this is the profile of COVID-19 in Malaysia. So our first patient was identified in 23rd of January. Then it go up to 18th of March. That's where the government start to impose movement control order, where every day we have about 100 to 200 patients. And then the peak active patient was on the 7th of April, where we have about 2,579 active patients. Then after that, the numbers going down slowly. Up to today, actually, we only have 1,200 active patients, and the number of new cases keep going down, about like 20 to 30 patients a day throughout the country. Okay, so that is the scenario of COVID-19 in Malaysia. So start from today, the government have allowed us to go to work. Only that number of staff that can attend the office will be at the maximums of 70%. Next slide, please. Can we go to the next slide? Can we go to the next slide? Okay.
Maybe there is a little bit error, so we have to wait for a while. So sorry for this inconvenience.
Okay, no problem. Okay, now this is the scenario of COVID-19 in hospital UKM. Okay, for your information, UKM hospital is a 600-bedded hospital, but we are not appointed as COVID hospital for Kuala Lumpur. So in Kuala Lumpur, there is only 2 COVID hospital. Yeah, so we are not one of them. However, we also have some patient that was referred to us. So I cannot show you the numbers, but I can tell you verbally. So it's about the total cumulative patient of COVID that attend the hospital is about 200. Almost all have been discharged from the hospital. 1 death, 4 been transferred, and just a small numbers like less than 10 are in treatment currently. So hospital UKM only manage positive cases with no or moderate symptoms. So we don't go for the severe one because the severe one have to be sent to COVID-19 hospital, meaning it is not our outpatients. Yeah. Next slide, please. Okay. So the main role of pharmacists in this COVID-19 period, it's still the same as usual, you know, business as usual, whatever we do. Drug supply have to be continue, counseling have to be continue, whatever it is. Only that we wear PPE where appropriate. The scenario in Malaysia may be a bit different compared to Indonesia or in the UK or in Ireland because we don't have dispensing separations. What it means that all patients will come to the hospital to get their medications. Because of we don't have dispensing separation, the patient, the utilization of community pharmacy is very, very low, meaning that everybody go to the hospital. So our challenge to maintain medication delivery is one is the crowd, because everybody will come to the hospital to get their medications because they will not go to the community pharmacy because it is cheap and whatever reasons. Yeah. So that is our first challenge. Then the second challenge regarding this COVID-19, because the crowd, and I think everybody knows about the need for social distancing. So that is another challenge that we think of. Another big challenge in maintaining medication delivery is that the government have already imposed movement control order, meaning that that is quite difficult for the people to move around. So we have to minimize traveling or need to be present in the hospital. So when we change or we extend our services, we have to look at these three main things. So the first one, reduce crowd. Second, maintain social distancing. And the third one is minimizing the traveling. Next slide, please. So by that, there will be at least 5 value-added services that we practice in this COVID period. Actually, some of this has been practicing before, but when we have this COVID, all this has been like optimized. You know, everybody is using these particular disease more than before. So the first one is medication via post, meaning we will post the medication to the patients. And this is limited to tablet or capsules. Yeah. The next one is pharmacy appointment system, meaning that they will book time and date when they will come so that they can reduce their time of waiting in the hospital. The next one is drive-through pharmacy, meaning they come, drive, and take their medication and go away, just like how we get our burger from McDonald's. Number 4, we also introduce locker for you pharmacy. This is, we put a locker or a small locker in our hospital lobby. What the patient needs to do is they come and put several passwords that has been given to them through WhatsApp to open their box, then they take their medications. And number 5 is integrated medication dispensing system. This integrated medication dispensing system means that if, let's say, the patient come to Hospital Kuala Lumpur for review, and these patients have to go back to Malacca, it's about 2 hours from Kuala Lumpur, so they can get their medication at any government hospital or any government facility that is near to the patient home, meaning the patient don't have to travel to the hospital where the patient been reviewed by the doctors. Next slide, please. Okay, so what we do in PPUKM is that although I mentioned to you the value-added services, there is about 5 different types. So what we practice extra is the new 2. Yeah. So inpatient services, business as usual. Only that, as I mentioned earlier, the PPE is very important in handling patients that are hospitalized. Then for outpatient, our specialist clinic, we close almost all the specialist clinics. We only entertain patients that are either they have urgency, emergency, or severe cases. That is the only clinic that is open. Others are totally closed. So how the patient gets their medication from our UKM hospital, as I mentioned, the first one is by postage. We post the medications. So what the patient have to do is they have to call or WhatsApp the Department of Pharmacy 14 days before their supply completely finished, so that we can prepare all their medication and post them through post laju, or this is courier. Usually it takes about like 1 or 2 days only. So it's very fast. The second one is drive-through. This one, the patient have to call 1 day earlier before they come and pick their medications. So they just call, give us their registration number. Then when the next day, when they want to come to pick up their medications, what they need to do is they just call us again. Then if their medication is ready, we will call them to drive through in front of the hospital where they can pick up their medication. But before they pick up their medication, we will check all their registration number again to make sure that they are taking the right medication for them. So that is the add-on things that we do in the hospital, meaning that we add the drive-through and also postage of medications. Other than that, as mentioned earlier by the first speaker, purchasing of PPE is a core business of a pharmacy, not just PPE, but other things also. Another area that is quite challenging as a pharmacist is drug information services. This is another thing that when we have these COVID problems, so there is a lot of other things that come into the picture. The first one regarding drug information challenge is update on current evidence regarding pharmacological management of COVID-19. Because there is a lot of study being done, but most of them are poor in terms of design and whatnot. So the pharmacist is the one who have to collect all this information and do a summary together with the treating physician or IED physicians to make a specific protocol for the hospital. The second job of the pharmacist in drug information is to give advice to patient on fake informations. There is a lot of fake or false informations that the patient have heard through media, social, whatever. So we need to correct all these things. For example, people talking about you can just sunbathing, get the heat, so that can kill COVID-19. Some even say you can drink alcohol because it can kill COVID-19, and then some also, there is a fake news also saying that COVID-19 is more serious in Chinese race compared to others. So all this need to be tackled, because if you don't tackle this, meaning they are not practicing the correct hygiene techniques, the social distancing and whatnot. So that is the second part that is very important as DI pharmacist, drug info pharmacist. The third one is to empower patients regarding social distancing and appropriate use of masks. There is a lot of other issues also regarding how to use the mask. You know, some ask the patient in the fake news or the false news, you know, or messages mention about how to use the surgical mask, the blue side, the white side, and whatnot. So all these need to be corrected or advised by the pharmacist. Can we go for the next slide, please? So this should be my last slide. Yeah. Other supports is production of hand sanitizer. So at the earlier stage of the COVID-19 in Malaysia, our small manufacturing unit in the hospital start to produce hand sanitizer for hospital usage and also for the university usage throughout. Some of the pharmacies that are working under administration, such as that are involved under FDA, they have been mobilized to support the frontliners for COVID-19 screening. And the other things that we also do is online counseling. So basically that are all the roles and new things that we do to overcome, to support these COVID-19 conditions in Malaysia. Thank you.
Okay, thank you very much, Professor Muhammad Mahmud Bakri, for the speech and for the sharing session. It's very nice. So the next agenda will be the sharing session from Northern Ireland, United Kingdom, and also the panelist discussion. For the next sessions, I would like to invite Apotheker Nadia Farhana Syafhan, Sarjana Farmasi, Master of Science PhD candidate as a moderator. Now taking her PhD degree in School of Pharmacy, Queen's University, Belfast, United Kingdom. For Apotheker Nadia, the time is yours. Hello, Mrs. Nadia. Okay. Bu Nadia.
Yeah, no, I'm just checking about the video. So can I start the video right now?
Yes.
Can you start the video? Because he told me that I couldn't start the video. No, you have to.
So, sorry, I'm just checking about the video, so I cannot start the video. Can you see me, everyone? Okay, no problem. No. No. So, okay, start my video. Thank you very much. Okay, thank you very much, Apotheker Laras, for having me for our next topic. Good afternoon, colleagues in Indonesia. Still morning here in the United Kingdom, a bit cloudy at the moment. It is a great honor for me to be a moderator for this section entitled The Role of Pharmacists During COVID-19 Pandemic, Case Study in Northern Ireland, United Kingdom. It is also my pleasure to introduce our two speakers at a time who will deliver a 30-minute presentation entitled Pharmacy and Medicines Optimization Innovation Center Response to the COVID Pandemic. The first speaker is Mrs. Diane Gill. She studied pharmacies at Queen's University, Belfast, United Kingdom. After pre-registration training, she moved to England in 1980 and commenced a career in clinical pharmacy, which was in its infancy at that time. She worked in several hospitals in England as a senior pharmacist, further developing clinical pharmacy until she returned to Northern Ireland in 1993. She has also led the award-winning clinical pharmacy services in Northern Health and Social Care Trust for many years. Her interest is in wound management, so she undertook a master's in wound healing and tissue repair in Cardiff University in 2000 and has been a pharmacist prescriber since 2009. She is a clinical pharmacy services manager who has recently taken up post as the interim head of pharmacy and medicines management in Northern Health and Social Care Trust. Not only that, she's also an assistant director, Pharmacy Clinical Services of Medicines Optimization Innovation Center, Northern Ireland, United Kingdom. The second speaker is Professor Michael Scott. He has held a number of positions within the hospital service sector of the health and social care system in Northern Ireland since registration in 1982. He was awarded a PhD in pharmacology in 1982 and made an honorary professor of pharmacy practice at Queen's University Belfast in 2009. He has published numerous full papers and made numerous conference presentations worldwide. He has led teams that have won national and regional awards relating to medicines management and infectious disease work. He has also awarded the Global Health and Pharma 2010 Medal for Outstanding Contribution to the Health Service at national level. Also received the award for Outstanding Contribution to Pharmacy in Northern Ireland from the Ulster Chemists Association. Currently, he is a Director of Medicines Optimization Innovation Center, Northern Ireland, United Kingdom. Without further ado, Diane and Professor Scott, the time and the screens are yours.
Thank you.
Okay. Thank you very much, Nadia, for the introductions. We'll just mute that.
Okay.
Go on now.
So Diane is going to speak first. If you'd like to move to the next slide, please, Nadia.
Yeah.
So Salam Paji. It's still morning here in Northern Ireland, so that thought we would say that for you. So thank you, and I'm going to pass you on to Diane, my friend and colleague, who's going to start with the presentation. Thank you.
Next slide, Nadia. Thank you. Thank you very much for inviting me to speak at your webinar. It's been very interesting, and it's interesting to see there's a lot of commonality between what we've been doing and what you've been doing. Next slide. So just to, in case you don't know, this is where Northern Ireland is red, the little red dot in the UK. And we're one of the trusts within Northern Ireland. Population about 470,000. Next slide, Nadia. So the challenges that faced us whenever COVID started to arise in Northern Ireland were workforce, controlled drugs, social care, clinical pharmacy services, oxygen and procurement. These were sort of our main problematic areas as we saw. Next slide. So the workforce challenges, we had staff isolating. So if staff were in contact with a family member who had COVID symptoms, then they had to stay at home for 14 days. Within the UK, if you were designated a high-risk patient, then the member of staff would have to be shielded for 12 weeks. So we still have staff members who, because of their medical condition, they are classified as high risk. They are shielding at home. So we are trying to give them work to do at home. So we have a remote technology in place to try and facilitate that. Within the UK, we have also had issues where the schools have been closed. So that has created childcare problems for staff who are trying to continue to work. So all of this led to quite a sort of change in our workforce. Social distancing was mentioned in here. Social distancing is 2 meters. So we try to adhere to a 2-meter rule. Because of the changing environment, we were changing roles of many staff within the pharmacy department. And we saw certain areas as priority and we deployed staff to those areas. We had to then deliver specialist training because staff weren't necessarily familiar with those areas. And we extended our hours. We had worked 7 days per week, but we extended our hours. We don't do a 24-hour service here. That's just covered by emergency on-call, but we did extend our hours of service. And then probably one of the most important things that we had to think about and take care of was the health and well-being of staff, because we have quite a large workforce. We have, well, about 200 staff. Many of them are quite young and were sort of unfamiliar with the challenges that were going to be ahead, and we had to see how we could support those staff. Next slide, Nadia. So social distancing, what did we do about that? Like one of the previous speakers, we tried to reduce the traffic to the dispensary. And we zoned our dispensary floors to try and maintain the 2-meter distance. That wasn't always easy because staff were continually moving around the dispensary, but we did our best to try and adhere to that. We put up perspex windows in our reception area to protect staff, and staff were issued with medical surgical masks. Next slide. So control drug legislation was one of an areas where we thought was going to cause us problems. So we wanted to reduce paper. We don't have electronic prescribing, and we wanted to reduce the paper going to our dispensaries. So we introduced electronic ordering to reduce the CD requisitions coming to the dispensary. We relaxed some of the rules regarding our control drugs within the hospital now. Now, when I say relax the rules, we were still within the legislation, but we had put in stricter rules, probably more than were necessary. So we relaxed some of those. And because we wanted to help save nursing time on the ward, we had pharmacists on the wards who were helping with the ordering and receipting of the control drugs on wards. And then whenever, in this trust, whenever a nurse is administering a control drug, there has to be a second check. So we agreed that the pharmacist could provide that second check. So it was all about thinking about how we can help support the nursing colleagues. Next slide, Nadia. Social care. Within our trust, we are a hospital and social care, so we also have a role in the community. COVID centres were set up. These were centres where patients could go if they had symptoms, and we provided the medicines management for setting up those centres. We also have an input into the nursing homes. There's 122 nursing homes within our trust area, and we have input into those nursing homes. A lot of that is by doing virtual ward rounds with the consultants. We have liaised regionally within Northern Ireland to come up with a list of anticipatory care medicines, so that these are always available in a care home in case there is a need. When a doctor visits a patient, they need to have medication ready, available for them. So we produced these pandemic packs, which we issued to care homes. Next slide. So clinical pharmacy services here. We have a very comprehensive clinical pharmacy service within the Northern Trust, but with the onset of COVID, we realized that we were going to have to maybe change our focus. So the areas that we were going to focus on was critical care, palliative care, respiratory, antimicrobial stewardship, and then and chemotherapy. Next slide. So critical care, we were increasing the critical care beds from the trust-wide was about 12, and that was going to potentially increase to 31. So we knew that staff were going to be redeployed to, nursing staff were going to be redeployed to help run these intensive care beds. So we then decided to redeploy some of our pharmacists and technicians to critical care, and we provided some very intensive training for them. There was a need for ready-made infusions for intensive care to reduce partly wastage of critical care medicines. It was felt that if pharmacy were involved in making the infusions, that we would decrease waste. We would also save nursing time because of the intense nature of nursing within critical care. If the infusions were ready-made, that would save their time. And also because we had nurses redeployed from lots of areas to support intensive care, they weren't going to be familiar with making up these infusions. So we saw this as one of the roles where we could help our nursing colleagues. Next slide, Malia. So as well, the clinical pharmacists within intensive care quickly developed regimes for constipation. That was one area that was a particular problem within intensive care. We also helped develop feeding regimes with dietitians. We developed an opioid weaning protocol to help patients come off their opioids. And we produced IV infusion posters so that there was a lot of information available to support staff who weren't familiar within the areas. We also then just in-house developed some Excel calculators, which helped work out this aseptic infusion calculator. It helped us know how many vials of particular products were required. And then also our renal replacement fluids. We had calculators to help us calculate how much was actually going to be required. Next slide. The clinical pharmacy technician, critical care is the one area where we do have electronic prescribing, and the clinical technicians, they monitored the Cardex and they checked for medications that were required on a daily basis for the COVID patients. And we managed the medications in the COVID bay, making sure that they were all available in the bay on a daily basis. We didn't want to store medicines in the bay because then we wouldn't use them once they came out of the bay. So we managed those on a daily basis. The technicians also checked our renal replacement stock, and they also prepared the IV order for our IV prep area. Next slide. Thromboprophylaxis was another regime that we, protocol that we developed for use in intensive care. And this is, it's a draft guidance that we have developed, and it was sort of a mixture of other protocols that were out there and what we were actually doing. But thromboprophylaxis is one of the big areas in intensive care where we are trying to, it has caused problems and that has blocked filters. Patients have clotted and it has blocked filters, and we have increased use of filters. So it is an area that we are looking at within intensive care. Next slide. This is the IV prep area that we established. This was an area outside the intensive care. I didn't mention our intensive care had to actually move to a ward, and it was built in a week into an intensive care area. This was a meetings room outside that ward, which we then have turned into an IV preparation area. So we've extended our aseptic service within pharmacy, and we have used redeployed nurses. So nurses, as I mentioned earlier, some nurses were shielding and isolating and not able to work on their normal wards. So they were redeployed to us, and this was sort of seen as a safer environment for them to work in. So we trained up nurses. I know they do reconstitute and prepare infusions, but we trained the nurses up to pharmacy sort of standard, and we developed worksheets and processes, and so this was an area where we are now providing the injectables for intensive care. So we got the kit, we got the benches. All of this was just made available within a week, so it was a very quick setup. So next slide. Palliative care was one of the other areas where we felt we would have a large input, and we redeployed some senior pharmacists to this area because we recognized that it was a difficult area to actually work in. So we have had 2 pharmacists who have been working in this area, and they've been involved in symptom management, advice to the ward and specialist teams. They ensure appropriate and rational use of syringe pumps. We were concerned that at the start of COVID that we maybe wouldn't have enough syringe pumps for all patients. We're ensuring the appropriateness of medication, looking at hepatic and renal failure. We would do a lot of de-prescribing, so we're stopping medicines and patient counselling, and then patients, or if they're going home, we'll prepare the discharges for them. Next slide. So we also had 2 wards that were designated as sort of respiratory COVID, so we allocated a senior pharmacist there. And I suppose in the respiratory ward, it was slightly different to what we expected. It wasn't our normal respiratory patients, and they actually didn't have an awful lot of demands from a medicine point of view. And our main area of concern on those wards was the oxygen requirements and the capacity. This patient is on airflow, which uses a high oxygen capacity, and Michael will be talking about that shortly. Next slide. Antimicrobial stewardship. We do have a team of antimicrobial pharmacists, and what we did was develop an alternative antimicrobial guideline, and this was really if we did get very busy, and thank goodness we didn't, but in case we did, we changed our guidelines so that there was less times of administration. So we would move from maybe a 4-time-a-day prep to twice a day or once a day. So this was all thinking about trying to save nursing time, but we didn't actually have to introduce that guideline. Next slide. So chemotherapy, we established a virtual clinic, and oral chemotherapy was by pre-arranged call and collect, and we did deliver some. We had some volunteers and transport drivers who were doing delivery, and we also prepared IV chemotherapy, and patients were scheduled to attend at a particular time rather than a number of patients arriving at one time. We wanted to minimize the number attending and the time spent in the unit. Next slide. Now, Michael will talk about oxygen in a bit more detail, but within the trust we did establish an oxygen COVID group because we were very concerned that with the increased equipment, would we be able to maintain the supply, the flow rate to all of the outputs. So we get this chart downloaded from our telemetry system. So we keep an eye on this daily. Next slide. Procurement, I think procurement has been mentioned as a challenge, and yeah, it was, critical care medicines were a particular challenge, and MOIC did do some modelling, which it has been used regionally to try and help with that, and Michael will talk about that. Next slide. So as mentioned by the previous speakers, PPE, all trusts in Northern Ireland aren't involved in PPE, but we very much are involved in PPE. We've had increased volumes, and we've had to redeploy staff to try and cope with the volume. We have got a lease on a warehouse to cope with the volumes that we're getting in. We were getting lots and lots and lots of queries about PPE. So we now have set up a dedicated email address for PPE queries. And we have used a redeployed nurse to help us deal with those queries. So that has been working very well. So this is our pharmacy team, and we have Northern Trust Stars program within the trust, so you nominate some of your team to become a Northern Trust Star. So this was our store team. Okay, thank you. Next slide. We are taking part in some clinical trials. At the start, we were getting requests for, as your earlier speaker mentioned, the hydroxychloroquines, and we were very much given the direction that we should not be using any new treatments for COVID unless they were part of a clinical trial. So we are involved in a couple of trials, and also one where they're collecting information on medications that patients have received. Next slide. So I suppose one of the challenges that we had was to try and keep everyone up to date. As I said, we have quite a lot of staff, and they're over 3 main sites. And we now have a virtual meeting with all the sort of senior managers every day at 1 o'clock. We then, and we categorize our actions, we then communicate with staff every day by email to let them know what is happening, what is going on. And we have also then centralized a query system for staff if they have any issues that they want to bring up or to be discussed. And we address those through that daily meeting. So it's just so important to try and keep everybody involved and know what is going on. We've established a system to record any risks or relaxing of the rules so that we know, what we have done, what we have changed. We are clearing everything that we do. Over the last couple of months, we've made an enormous amount of changes, and I suppose now we're moving into the reset, and we're looking at what worked and what didn't, and what we would like to carry on even outside of the COVID period. So that's what we're sort of heading towards now. We're still not out of it, but things have calmed down a bit, but we want to be ready if we have another wave. So I'll hand over to Prof. Okay.
Okay. All right. Thank you very much. This is a picture of the Giant's Causeway, which is on the north coast of Northern Ireland, a very popular tourist attraction, although we're not allowed to go there at the moment. So go to the next slide, please, Nadia. Okay. So lovely. Thank you. Just to give you a brief summary of MOIC. So it's a regional centre set up by the Department of Health just almost 5 years ago. And we work with the health sector, also with the universities, and we work closely with Queen's University in Belfast. And we also work with the commercial sector to improve medicines use and patient care. And we work across a number of countries in Europe. We're doing work particularly at the moment in Poland, at Estonia, and also we work in Scandinavian countries. And with James McElnay from School of Pharmacy at Queen's, we've a lot of connections in the Middle East, particularly with colleagues in Jordan. So we do a lot of work there around medicines optimization, digital technologies linked to that in older people, and healthcare acquired infection. So go to the next slide, please, Nadia. So Professor Nassari was talking about personal protective equipment. So we've had very similar problems to yourself. So the MOIC part of the team with some people from the Department of Health were then set up to be a technical assessment unit for all offers of personal protective equipment. So we have received over 1,000 offers to date from 500 different companies. So we've had to put in place a process for assessing those. So we look at them and assess them against all the current specifications set by UK government, WHO, or Health and Safety Executive. And then we've added some additional items to our requirements. And we also do some very rough testing, like pouring water on gowns to see if they're water repellent. So that has worked very well. We've rejected a large number of items due to perhaps certificates not being correct, etc. And we're now work with our regional procurement team to actually put forward a purchasing of items required for the region. So that work will be ongoing, and we're hoping to put in place a new robust process going forward with procurement, and we're hoping to start that in the next week or so, so that we are prepared for the next problem wave and get proper equipment available. Next slide, please, Nadia. Diane has already mentioned oxygen. We then were involved in leading on oxygen supplies, particularly initially liquid oxygen in hospitals. And we wanted to look at the total capacity and then how much of that could be delivered towards without setting off alarms or actually having the system freeze up. So that took quite a bit of work to work out the requirements. And we were able to prioritize work with British Oxygen Company, BOC, who is the main supplier, to put additional capacity in the key hospitals, initially in Belfast, as we were trying to put in place a field hospital or a Nightingale hospital, as in London, to see if we could have the capacity. So we actually didn't need that, thankfully, to work with that. We were able to cope with the wave in April. The date was very similar to Professor Mohammed Makrakri from Malaysia, around about 8th of April. So we've now linked the liquid oxygen capacity to device demand. Diane highlighted the very oxygen intensive needs of Airvo machines, which can be used at 60 litres per minute. So we've been trying to do that now, working to connect potential command to devices that people would require for their care. Next slide, please, Nadia. So in addition, we already have developed a tagging and tracking system within the hospitals here in the Northern Trust. So it means we know where every device is. We also have information about it, its maintenance, its servicing requirements, etc. So we're looking at that initially now to look at ventilators, and I'll come back to that in a moment. Community oxygen supplies has also been a concern, that we would have enough concentrators and cylinders with regulator heads and trolleys to utilize. So again, we're finishing that off at the moment in terms of ensuring we have enough supply for people in their own homes and then care homes. There's been sadly a lot of deaths. Well, half our deaths have been in care homes, and we're trying to ensure that all the PPE and oxygen requirements are appropriate to meet patients' requirements in those care homes. Next slide, please, Nadia. I mentioned ventilator consumables. We have purchased a number of different ventilators in the region. And therefore, because we were still involved with medical devices, as Professor Ratnasari said, as in Indonesia, which is unusual in the UK, we've actually been able to link the ventilator disposable needs with each type of ventilator, both mechanical and non-invasive, and we're finalizing that for the region. So we have an idea of what our requirements are, and also for other oxygen therapy items that we would require, that would be generic for any type of device, and then we'll put in place an appropriate procurement arrangement with our regional colleagues in the supplies department. Next slide, please, Nadia. We've also been involved in critical drug supplies, and as Diane said, we've now developed a regional model for critical care drugs, particularly the neuromuscular blockers have been a particular problem and continue to be so. So we have developed a model linked to critical care bed occupancy and the length of stay, which is very different for COVID patients, as is their medication needs. So we now have that completed for that particular area for COVID requirements. And we've just submitted a paper for that for the region. So they're also now looking at, we'll now be using that to work with regional procurement. And we link in with Scotland, Wales, England to look at national allocation. So we will be able to link our use to our patient numbers and requirement, but based on COVID numbers, not business as usual patients, which are very different. Next slide, please, Nadia. We've also been helping out at a regional level, looking at tests for COVID, both antigen tests, various lateral flow type technologies, and antibody tests, possibly saliva tests, etc. So we just link in with colleagues. There's a specific expert group, and we connect in through one of our colleagues and are assisting with potential assessment or evaluation of some of the kits that are now available for these purposes. Next slide, please, Nadia. Decontamination. We've also now been involved with a new group to look at potential decontamination protocols for PPE. And the group is just about to finish the report to go to the Department of Health. So we want to look at what could be decontaminated safely and effectively, and how could we do that. So we will also be looking at potential new solutions like UV general irradiation, ozone, and vaporized hydrogen peroxide to look at those potentially could be used both on maybe on a small scale at the end of a ward, or on a large scale, as has been done in America with the Battelle decontamination unit. So again, that's work that will be ongoing to try and manage the significant volumes of these products and the significant costs that are being incurred. Next slide, please, Nadia. We've also been looking at evidence evaluation. Some of the program managers within MOIC have been looking at various proposed treatments, which have been already mentioned, like chloroquine, hydroxychloroquine, etc. So we have someone looking at those and keeping that up to date, and to link in with potential work to be done in the region. Next slide, please, Nadia. We've also, as Diane mentioned, the COMET study. This has just been completed. This is led by a friend of mine, who's Professor Hugo van der Kooi in Erasmus in Rotterdam. And we've looked at 50 patients in Northern Ireland and a total of 4,000 patients in 20 different hospitals in 13 countries. The original piece of work was to look at whether angiotensin receptor blockers or angiotensin 2 blockers were detrimental in COVID patients. And that was the original synopsis. So he's looking at other medicines and he's hoping to increase the data set. So we've been involved with that piece of work. Also now with Diane and the team here, we're looking now on an app, which is called the COVID Critical Care Index, which is being piloted in hospitals in the south of Ireland, in Dublin. So we've got funding regionally to look at that, to see if that can improve care and make it easy for someone to manage a patient with the app, which will give you a green if the patient is okay, amber if they're starting to have problems, and then red if they're in a critical condition. So we're working to see how that can be developed. And we've also submitted another bid with a local company to look at the oxygen work we talked about, to see if we can develop an application that would allow us to do predictive analytics and algorithm development to predict oxygen requirements based on patient need, particularly those outside the main intensive care, but in a high oxygen requirement ward for that purpose. So that has been submitted and we hope to hear next week if we've been successful or not. The final piece then is we're looking at a new model for intensive care medication needs based on what had been our normal business. Then the additional work at a level of COVID, which we still have, plus a potential second wave. We're trying to develop a model that would predict and enable us to manage those medications and potentially all the devices associated with these patients going forward. So go to the next slide, please, Nadia. This is another picture. This is the Titanic building in Belfast, which you'll have to come and visit. So again, when it's set up after the Titanic ship, which obviously sank in 1912. Go to the next slide, please, Nadia. So Terima kasih from both myself and Diane, and I would like to thank you for inviting us to speak to your webinar today. We're very pleased to do so, and they have our contact details if you wish to get in touch with us for the presentation. So thank you very much indeed from myself and Diane. Thank you, Nadia, for the slides.
Thank you very much indeed, Diane and Professor Scott, for your very interesting presentations. So now we can continue to a 30-minute discussion session. It will be divided into two parts. The first one is a 20-minute discussion with 4 distinguished panelists representing 4 different stakeholders. And the second one is a 10-minute discussion based on questions from participants. So I will give the time to our panelists for your comments, response, or even questions to our speaker. We have Professor Ratnasari, Prof. Bakri, Diane, and Professor Scott. I would like to invite the first panelist who is representing colleagues in Indonesian Pharmacists Association, Professor Dr. Apoteker Carrie Lestari, Bachelor of Science, Master of Science. So
kita melihat bahwa ini sulit untuk berbicara dari task force dan berbagai sektor ini harus dipersiapkan. Pertama ketahanan pangan, ini juga jelas pertanian. Bagaimana mencetak skala baru, bagaimana meningkatkan produksi para petani. Saya yakin di desa-desa di daerah ini bisa beransur.
Professor Carrie, can you hear me?
Dan ini yang harus dikonsentrasikan untuk membantu mereka. Kalau sekarang kemudian
Ida or Malanda, can you help me mute some of the participants here, because I can hear other participants' sound. Okay, so Professor Carrie, could you please start your video so we can hear your comments or feedback or even questions to our speakers?
Tapi kalau kita berikan bantuan langsung tunai, kemudian kita pun menghidupkan kembali warung-warung desa, bates.
or probably while we're waiting for Professor Carey setting up the
kita bantu bersama keputusan
okay, or probably I'm inviting the second panelist, college representing so this panel is representing colleagues in National Pharmacy Committee, Professor Dr. Apotheker Umi Athia. So she's a member of National Pharmacy Committee. Prof. Umi, could you please start your video while we're waiting for Professor Carey? Okay, Prof. Umi, time is yours.
Okay. Thank you very much. I would like to thank to the committee that gives me opportunity to discuss about the topic. Professor Michael Scott and Mrs. Diane Gill, thank you for your excellent presentation about pharmacy and medicine optimizing innovative center respond to the COVID pandemic. I think your activity about medicine management and medicine optimization like the similar with activity in Indonesia. The different between your country and our country in the quantity of patient and the facility and equipment to overcome the problem of COVID pandemics. Maybe I will to share, yeah, I will explain current situation in Indonesia. Your activity, the clinical pharmacy activity in Indonesia, activity of clinical pharmacy in the hospital have been ongoing process routinely mentioned, therapeutic verification and therapeutic drug monitoring to achieving safety and efficacy of medicine use. Especially in COVID pandemic, our hospital involve our clinical pharmacists in solidarity research, which conducted by WHO, maybe in other country like that activity. But in the second, I will to explain current situation in Indonesia. We have to overcome the problem of COVID-19 pandemic. Maybe at a glance, I give some picture about activity. In our country, we have to collaborate between academician, health practitioner, and government through their institution. We have 5 institutions related to overcome the COVID-19 pandemic. Maybe National Agency of Drug and Food Control, Minister of Health, Minister of Research and Technology, Researcher in Higher Pharmacy Education, Indonesian Pharmacist Association as a representative pharmacy practitioner. The result of the collaboration until now in our country result the first diagnostic kit result from collaboration about many university, 3 university and agency of research. Rapid test kit with the name is RHIGA, Republic of Indonesia Hepatitis Agent Laboratory in Gajah Mada University and Erlangga University. And the second product, guidance book to guide to treatment COVID-19. This drug informatorium, drug information COVID-19 in Indonesia to guide how the treatment case of COVID-19. And the second book is supplement how for community education to guide using herbal medicine and supplement wisely to communicate to education and community. And the third, the activity of clinical pharmacy, as you have done, maybe not special focus like Michael Scott done it. Thank you very much.
Thank you very much, Prof. Umi. So Professor Scott and Diane, would you mind responding Prof. Umi's comments?
Yeah. Thank you very much. We've muted that now. That's okay. Thank you very much. Yes, I think it was very interesting to see how COVID-19 has been managed in Malaysia and Indonesia. And we can see similar problems that we've faced, and particularly in relation to PPE. It's very, very interesting discussion. I think we have the same problems, but we need to try and find the same way forward, which is better specifications of product that meet requirement, because I think current specifications are not definitive enough in terms of that. So I think that will be something going forward. I think also, as Professor Dr. Umi was saying, I think it's important to work together. You were mentioning the Ministry of Health, the Directorate of Ministry for Information Technology, and research, the Research Centre as well. I think that is what we do with the Innovation Centre, is to bring universities, hospital sector, technical companies. We develop potential software solutions. I think if we work together, we can make things a lot better, because sadly, I think we will have a second wave, or perhaps a third wave. So I think we need to learn from what we've got to date, and then work together to develop new technical solutions, maybe new drug treatments, and better management of medical devices.
Okay, thank you very much, Professor Scott. Diane, do you want to have some words? Diane, okay.
Sorry, Nadia, I didn't hear what, sorry, what did you say? Sorry.
No, I'm just wondering, probably you have your words responding what Professor Umi says. Or do you have any comments?
Oh, I think it was very interesting to hear the similarities and the fact that we don't know what we should be using to treat COVID. And it would be very interesting to have, you know, some evidence to know exactly what we should be doing. But unfortunately, we don't have that. We're sort of gathering it. So it would be good to have, you know, everybody's doing the same thing, really, aren't we? It's interesting. We're all have the same goals in mind. So,
yeah. Okay, thank you very much. So I'm inviting the next panelist. So now I can see Professor Dr. Agung Endro here. So, so he will represent colleagues from Association of Indonesian Pharmacy Higher Education. So he is a Vice Chairman of Educational Support Area, Association of Indonesian Pharmacy Higher Education. So the time is yours, Prof. Agung.
Yeah, thank you very much, Bu Nadia Farhanah, Syafan. Good afternoon, ladies and gentlemen. Your Excellency, Dean and Executive Board, Faculty of Pharmacy, Universitas Indonesia, and honorable speakers, Professor Nosari Andrajati, MS PhD, Apotheker, Professor Michael Scott, hello Michael Scott, and Mrs. Dian Gill, and Associate Professor Muhammad bin Makmur Bakri from Malaysia. actually, in my opinion, it is, I agree with your opinion. There are many similarities among us, regarding to the role of pharmacists in COVID-19 pandemic, among us. Briefly, pharmacists are very strategic and important role and must be at the forefront in preventing COVID-19 pandemic, either as educators or practitioners, especially in university, society, community, as well as hospital. I would like to criticize the role of pharmacists in community and hospitals. In Indonesia, I think we need to thanks to the previous minister, because in accordance with Minister of Health Regulation, Permenkes, number 72, 2016, regarding pharmaceutical service standards in hospitals. Pharmaceutical services are comprehensive services for providing quality of drugs, product-oriented and direct services to patient-oriented, both of which are inseparable elements of the health system in hospitals. These activities are oriented on improving the quality of life of patients, so that there are two important points of the role of pharmacists. The first, management and provision of pharmaceutical supplies and pharmaceutical services to patients. I would like to explain the first, management and provision of pharmaceutical supplies. Make a plan for the needs of drugs or medical devices and personal protective equipment accurately in the hospital. And find the references and guidebooks to improve pharmacists' knowledge and ability in finding solution if drugs or medical equipment or personal protective equipment, in Indonesian name alat pelindung diri, needed is difficult to obtain. And about pharmaceutical services to patients, the role of pharmacists is to protect us, patients, and also others, and break the chain of transmission of COVID-19. The pharmacist needs to prepare the standard operating procedure that is a reference in healthcare. For instance, in pharmacy room sanitation, the use of personal protective equipment, service to patients with COVID-19, hand washing and prevention of infection, counseling, reusable of personal protective equipment. It is the role of pharmacists in community and hospital. In my opinion, we are educators in universities is also have the important role, to prevent COVID-19 pandemic, because we are also pharmacists, so we have such contribution in preventing COVID-19 pandemic. For example, in campus, we can provide viral transport medium for support laboratory PCR swab test. And many university, produce hand sanitizer and test the personal protective equipment. And also in community, social education, since awareness related to preventing COVID-19 is very, very important. For example, to make education, the public and community, how to implement physical distancing and social distancing. For the panelists, implementation of physical distancing and social distancing in Indonesia is a little bit problem, It is very difficult to make aware, for the community about physical distancing and social distancing. So it is very important for us how to educate the people, the society, and the community about awareness regarding to physical distancing and social distancing. And also how to educate the use of correct disinfectant and hand sanitizer, and how to use correct mask, mask, and how to say Google and etc. For this purpose, I think the courses soft skill, in the curriculum is very important. For example, public speaking, communication, leadership, Internet of Things, and etc. I think how to say, it is enough for me. Thank you very much for your opportunity to become panelist today. Thank you very much.
Thank you very much, Prof. Agung. Probably I will give the first opportunity to Professor Ratnasari, because Prof. Agung have said about the rules in Indonesia. Probably it will be more appropriate to be having some comments from Professor Ratnasari. Would you mind giving your comments?
Apaan aku nggak dengerin? Saya what do you mean, Nadia? Do you mean I will?
Do you have some words, Professor? Do you have some comments or feedback from what Professor Agung mentioned? Because he mentioned about what a situation in Indonesia. Probably you are the one who really understand the situation in Indonesia.
I think it's in my hospital, the big problem I think is for PPE. Yeah, okay. Because we need to protect the medical doctor, for nurses, and for ours as well. Yeah, and we don't have enough, I think, for this. So maybe I can comment about how we can reuse the respirator mask N95. We reuse after we sterilize with the oven at the 70 degrees for 30 minutes. This is, I think, this is the decision for the our hospital. If we don't have enough for the masker or respirator mask and 95, I think this. I think for the pharmacist role, I think we do, yeah, we do everything that I can do for work together, collaborate with the other health services, with the doctor, with the nurse, in our position. Okay, thank you.
Okay, thank you very much, Prof. Ratno. So I think I can invite the next panelist. I can see Dr. Apotheker Rina Mutiara M.Pharm. So she's the head of pharmacy department of Dr. Cipto Mangunkusumo National Referral Hospital, Indonesia. So she will represent colleagues from hospital. Dr. Apotheker Rina, would you mind giving some comments and feedback to our speakers?
Okay. Hi, Nadia. Hello. Good afternoon for all participants and presenters. I'm Rina from Cipto Mangunkusumo Hospital. Glad to hear your presentation and appreciate for all presenters for sharing your extraordinary experience to give pharmacy services during COVID-19 pandemic. There are several questions from me. The first for Diane. clinical pharmacy activity in UK, whether they keep doing such as drug counseling, visit the patient, because you said that in presentation, there are limited to patient area for pharmacy activity. And the second question for Prof. Scott, I would like to ask you about do you have a difficulty to procurement PPE, because in Indonesia, vendor has a difficult because they have difficult to get the material, because indeed in the world all country need PPE. So the last question for Mr. Makmur, I would like to ask you about your presentation. You said that maintaining medication delivery, your hospital minimize one of the way is minimize traveling to present in the hospital, such as medication via postage and extra. So do you have a drug criteria for send to the patient, such as drug thermolabile, narcotic, psychotropic, like this? Maybe this is for the question. Thank you, Nadia.
Okay, thank you very much, Dr. Rina. So probably I will give the first opportunity to give comments to Professor Bakri. Sorry, Prof. Bakri, we cannot hear your voice. No. Okay. No, we cannot still hear your voice, or probably allow me to give the opportunity to Diane or Mike to give the answers. Okay, thank you very much. Okay, Diane, would you? Okay.
Oh, Nadia, I think it was about, the question was about, our comment, it was about clinical pharmacy and our patient contact. We've still undertaken our usual roles within clinical pharmacy, the medicines reconciliation and the discharge counselling and inpatient monitoring, but we have reduced our contact with the COVID patient, and that is partly because we have had problems with PPE supplies within the hospital. So we didn't want to use them if we just were going to speak to the patient for a short period of time. So we have been using phone contact with the patient. So we've been contacting the patient from, you know, if they've got a mobile phone, we've been contacting them from outside the bay where they are. And some of the individual rooms that they have intercom. So we have still had contact with the patients, but we have reduced it a lot and tried to use other means, but we still are carrying on with our usual clinical pharmacy procedures.
Okay, thank you very much, Diane. So Professor Scott?
Yes, no, I would agree with Dr. Rina there. Yes, we've had a lot of problems getting PPE. The problem has been assessing the quality of the offers. So and there is a very, very high demand, particularly from China. So we have been trying to get masks, gowns and gloves, etc. from China, but we've also been trying other routes now, and we've been able to get some probably from Turkey and Greece recently. But the other way we're doing it, we, as Professor Dr. Angung was saying, we've been trying to work with some of the universities have been using 3D printers to print masks, but also we've been working with local small companies and working with Invest Northern Ireland to ask them to redesign or repurpose their kits. So, for example, we can now make a large number of visors with a Japanese owned company in Belfast. They've redesigned their kit to make visors. And we're also designing local gowns, a company to make gowns for us. And we've just designed, again, a new apron design with our infection control team to get that produced locally as well. So we're trying to get items from everywhere to keep numbers up and not be as dependent on one or two suppliers, which has been the problem. And I think the demand is so high. And I think with a second wave, we need to have as many opportunities as possible from as many places as possible to cope with the next demand peaks.
Okay, thank you very much, Prof. Scott. Professor Buckley, have you sorted out about the sound now? I think if there is a problem with the headset, or probably you can like turn off the Bluetooth, or because we cannot still hear your voice.
Okay, hello.
Okay, okay. Hello, Prof. Bakri. Okay, or probably we can hold the answer from Professor Bakri. So allow me to continue with the next panelist, because now I can see Professor Carrie here. So
thank you.
Professor Carrie Lestari, she is the head of COVID-19 task force in Indonesian Pharmacists Association. So she will represent colleagues from Indonesian Pharmacists Association. So the time is yours, Prof. Carrie.
Thank you for the opportunity. First of all, I would like to congratulate the committee. This is a good webinar, international webinar, so we can exchange our experience together, how to combat the COVID-19 all over the world. And then congratulations to Professor Retno, my colleague from Universitas Indonesia. And then also for all the faculty member, Pak Mahdi from the Faculty of Pharmacy, Universitas Indonesia. And then from all the panelists that know we are facing for the new normal in the pharmaceutical care. We're facing about how to use some technology to have the primitive practice and then the patient care in terms of the COVID-19 pandemic. And then we see that from our college in Malaysia that already successful to combat the COVID-19, and then now the COVID-19 in Malaysia is already reduced. Also, it's still rise the pandemic, but I think it is not the peak at all because they also reduce some strategies to reduce crowd in hospital, maintain the physical distancing, minimize the need to present in the hospital, and also how to start to make the strategy to postage the medication, and also to use some regulatory in medication practice with use of the technology. And also in Indonesia, Professor Retno said about the telemedicine also, and then also about how to manage the patient care for the isolation, and then also the use of personal. I think for the personalized medicine for the patient care in the COVID-19 patient, and then also the therapy, and then also the asking is for the how to manage the workload and safety about all the pharmacists who has the front guard in the patient care in COVID-19 pandemic. So now we are facing the new normal or new era for the pharmaceutical care for the patient care and also clinical pharmacy practice in how to combat the COVID-19 patient. This is the interesting sharing session for us to have some inspiration about the good practices for all over the speakers here in the webinars, and thank you for the all the inspiration that you are already shared for us. And then I think we need to enhance our collaboration together to move forward together to combat the COVID-19, and then we're facing out for the new normal or new era for the pharmacy practice later on. Thank you for kind opportunity for me to become as the finalist, and then looking forward for later on collaboration with all of you. Thank you so much, and congratulations to the Faculty of Pharmacy Universitas Indonesia. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Professor Kerry, for your appreciation and for your comments. So I think we can go on with the Professor Bakri.
Nadia,
I think
can you hear me?
Yeah. Yes, we can hear you
okay.
right now.
Right.
Okay.
Right. This is regarding the medication through post. Actually, before we do the services through post, the courier services, we have give them certain training, meaning that how to handle these medications. It is not that they cannot handle the medication as like they are posting things, you know. So there is a collaboration, and also there is a specific or special program between the Ministry of Health and also the courier services. Okay, regarding who can receive this postal type of services, the patient have to be a stable patient on medications. How we define stable patient on medication is they have to be familiar with their medications, meaning that when they call, we also will interview them regarding their medication, how they took their medication and whatnot. So we have a confidence that they can deal with the medications. Yeah. And then for the type of medication that we send through post is only tablet or capsule. No for liquid or creams and whatever. So it is quite a stable dosage form. And it is not for narcotic or any dangerous drug like sedative drugs, you know, we don't send them through post. So there is a criteria on choosing which medication that we can post, which medication will not. Meaning that if let's say a patient have 5 medication, one of the medication is a control drug, meaning it is maybe a dangerous drug or narcotic, meaning that this patient will not be a suitable candidate to receive drug through post. So this kind of patient, they have to go through drive-through or they have to come to the hospital. So that's my clarifications.
Okay, thank you very much, Prof. Bakri. I think we've almost out of time, so I would like to thank you very much indeed to all panelists for your comments and feedback, so we could have very interesting discussion with our speakers. Before the next agenda is taken over by Laras, I personally would like to extend my utmost gratitude to all speakers for your precious information that clearly show us the importance of pharmacists' role during COVID-19 pandemic. Apologies if there is any inconvenience during this session. I'm now returning the rest of agenda to Laras.
Okay, thank you very much, Bu Nadia. So we will continue to the discussion for the participation. Held around 10 minutes only, and I would like to inform before that there will be 3 books for the prizes for 3 best participants who ask questions from penerbit Raja Grafindo Persada for this session. So for the chosen one, later please provide your identity like name, address, and email in your chat room. For the participant who would like to ask questions, please click raise hand in your Zoom application. After that, the chosen participant has to mention the name and also the domicile of origin where they come from. And later, I would allow them to ask the question. Okay, so let's start. Raise your hand. 1, 2, 3. So the first one would be Hilda Sherman. So Hilda Sherman, yes, Hilda Sherman, maybe you can turn on your microphone. Okay, Hilda Sherman, do you have any questions for our speakers today? First of all, please introduce yourself first, your name, and also where do you come from? Mrs. Hilda Sherman, are you there? Can you please turn on? Can you please turn on your microphone? Mrs. Hilda Sherman? Okay, maybe we change to other participant because cannot connect to Miss Hilda Sherman. So the first presenter would be Laila Komari. Okay, for Laila Komari, is there any question? Would you please turn on your microphone to ask the question? Laila Komari? Can you? Okay, maybe next because not connected. So maybe the other one would be Retno Yunitasari, who has raised her hand. Okay, for Retno Yunitasari, the time is yours to ask the question. Okay, since maybe there is a bit error. So here we also have some questions in question and answer toolbars. So this is a question from Nur Alam Abdullah. The question, Nur Alam Abdullah, let me see first. So for the speakers, there is a question from Aldan from Faculty Pharmacy of University of Indonesia. The question is, whether the pharmacists in hospitals apply the visits for pharmacists as a shape of clinical pharmacy service in hospital during the COVID-19. If they do the visits, how is the protocol for the pharmacists? That for the first question. And for the second question would be for the one from Belfast and Malaysia. Are there any chloroquine or hydroxychloroquine that is given in the hospital in Malaysia and also in Belfast? And the third question is whether the antibiotic also given with the delivery pharmaceutical service. Maybe we start the first question for the pharmacist, or maybe I will give the first question to Professor Muhammad Makmur Bakri in Malaysia. Is there any visit activity for clinical pharmacists in hospital in Malaysia?
Okay, can you hear me right?
Yes, I can hear you.
Okay, so in Malaysia, the visit for clinical pharmacy is only occur at the non-COVID wards. Because the hospital have a dedicated COVID ward and also non-COVID ward. So the clinical pharmacy is still active in the non-COVID wards. Only that they practice more of wearing the mask and also social distancing. You know, because every single patient that comes to our hospital will be screened. So if they don't show sign and symptom for the COVID, so they will be off for the non-COVID wards. If they show the sign and symptom, then they go for the COVID wards. Actually, we also screen for the RNA for COVID-19 before we admit the patient to the ward. I think the other question is regarding hydrochloroquine. Yes, we have it in Malaysia, but we'll see there's a long list of assessment need to be done before this hydrochloroquine was given to the patients, because I think everybody knows the side effect of the hydrochloroquine quite bad. So we use them in a category of patient that we think it will benefit the patients, and also the patient will not develop bad adverse effect from the hydrochloroquines. Thank you.
Okay, thank you. For the third question, that the antibiotic, whether the antibiotic also have a delivery system or like posted to the patient or not allowed in Malaysia? How about it, Prof? For the antibiotic.
Can you repeat the question again?
Whether the antibiotic can be delivered by postage or not?
Oh, the antibiotics.
The antibiotics, yes.
Okay, as I mentioned, the postage is only for stable drug use, meaning that these are on chronic management only. Because antibiotic, usually we use them for acute management. So we will not post the antibiotic to the patients, because this is for long-term management only.
Okay. Okay, thank you very much, Professor Muhammad bin Bakri, for the answers. And for the second opportunity, I would like to ask Mrs. Diane or Professor Mike from Belfast to answer the question, whether in Belfast, is there any pharmacist visits during the COVID pandemic in Belfast? Hello? Professor Mike or Mrs. Diane? Can you hear me?
Our wards are divided up into zones. So we have an amber zone and an amber zone and a red zone. So the amber zone, you just have to wear a surgical mask, and that's where the clinical pharmacist would mainly stay. the patients are, COVID patients are in a red zone, and then you have to have the full PPE. So we tend not to go in to speak directly to the patient unless we really have to. And that's because of the, we don't want to use PPE unnecessarily. So we try to use other means for contacting the patient. We would try and telephone the patient or use an intercom system. So we try not to use the PPE unnecessarily. So that's because basically of PPE shortages. As regards the posting drugs, we do post some medication, but we wouldn't post antibiotics. We have an OPAT service, which is outpatient antimicrobial treatment. So any patients who would be going out to the community and require antibiotics, they would be looked after by that team, and they would supply the antibiotics. We wouldn't post antibiotics.
Okay, thank you very much for the answer. How about the chloroquine and hydroxychloroquine? Is it also used in Belfast or not?
That's all. I don't think, Mike, do you want to add anything? No? Yeah.
So, okay, maybe we go. So for the first question about the visits in hospital, whether in Indonesia the visits still also done in COVID-19 patient or not, Professor Retno, maybe? Professor Retno Sari? Okay, maybe there is an interruption. So we will go with the next question, maybe, I think. So the second question is, Indri from Faculty of Pharmacy, Universitas Muhammadiyah Surakarta. The question is, whether in Malaysia or Ireland, there is an effort or activity that is specialized to find a new vaccine for the COVID-19, or just using the nowadays treatment that only potential for the COVID-19? Maybe for Professor Bakri, would you answer the question whether in Malaysia have kind of special activity to develop the vaccine for COVID-19 or not?
Okay. We don't have, at this moment, we don't have the facility to develop the vaccine. Another question is, what's that now? Can I get the questions, so?
Pardon? Sorry, I cannot hear your voice.
Can you hear me?
Yes. Now I can hear you, but before I cannot hear you.
Okay. So regarding the vaccine, at this moment, we don't have the facility or any research that I think people develop vaccine in Malaysia.
So because there is no facility, so there is no activity.
There may be a facilities, but I don't think we have anybody that tried. They might be trying to, but I don't think it is for commercialized use yet. I don't think there is a very high-speed research being done here.
Okay. Thank you for the answer, Professor Bakri. So the next questions would be for Professor Scott. There is a question from Agil Bradley Musa from Cipto Mangunkusumo Hospital, asked about would you mind to explain us about the protective equipment decontamination for Professor Scott? Would you mind?
Hello. Yes, I can explain. We would buy regionally for Northern Ireland our PPE, but as part of this process, the problem was we had so many offers of additional PPE, be it gowns, masks, visors, goggles. So we decided to set up a technical assessment unit with the MOIC team to look at all the offers, and we collected all the specifications that are currently available, be it from the government, from the World Health Organization, or health and safety executives. We have collected all of the specifications that would tell you that the product is good, and then we use that to assess any of the offers. It has been very hard to get samples. We like to get a sample, but a lot of the offers involved companies in different parts of China. It was very, very difficult to get samples. So we had to go on the certification or inspection reports from companies, or also perhaps references from either hospitals that the company has supplied that we could check. So we've built that into a new process, and we're now going to put what we have learnt from that into a very robust regional process going forward, working with colleagues in infection prevention control and with the health and safety executive. Okay.
Hello?
Hello?
Okay, we can hear your voice.
Is that okay?
Yeah, it's okay.
Oh, yes.
Okay. So, since Professor Ratnosari is here, hello? Hello? Hello, maybe there is a kind of error.
Hello? Hello?
Maybe. Okay.
Hello?
Okay. Okay.
Hello?
Okay. Hello. Hello.
Hello?
Hi.
Hi.
Okay. Maybe there is a kind of interruption, a bit error. Okay. So, Professor Ratnosari is here?
Yeah.
Yes. Okay. For Professor Ratnosari, there is one more question from University Kuala Lumpur, Rara. I would like to ask to any speakers that work at the hospital, so I choose Professor Ratnosari to answer. How is the monitoring of COVID-19 patients that are already recovered from the disease? And how about the recurrent cases in your practice? Is there any, or how is the rate? So she asked about, is there any kind of monitoring that must be given to recovered patient COVID-19 in hospital? Professor Ratno?
Yeah. Monitoring.
Yes, the monitoring for the recovered patient. Is there any special monitoring that it needs for them?
I think the point is negative test of the COVID test for the PCR, I think.
So for the negative test.
For monitoring.
For the monitoring.
Yeah.
Okay. How about the recurrent cases? Are there any cases in your hospital that happened the reinfection or something like that?
Not yet. I have not yet recover recurrent infection.
So there is not yet the recurrent infection
in my hospital, in our hospital.
Okay, thank you very much. And also, this is the question about whether in Indonesia also have visits, the clinical pharmacy do the visits to COVID-19 patient or not in Indonesia? Maybe
yeah.
in hospital?
Especially when the visit is for explain the patient who already finished their stay at the hospital. So the pharmacist visit for give the information to the patient how they can continue their medication at home.
Link or the visits is given to the discharged patient, right?
Yes, for the discharged patient only.
Is there any special protocol that need when give the information or education to the patient?
Yeah, we have the protocol for it. Yeah, for the patient, we give the medicine for the patient and also for the explanation, and the patient can also ask to ask about their medicine to us, then so we can discuss about it.
Okay. Okay, thank you very much, Professor Ratnasari, for the answers. So I think that's the last question we will discuss. Thank you very much for all of the participants, speakers, and also panelists for the discussion session. So in a brief, we can conclude that from this webinar, the pharmacy has many roles during pandemic COVID-19, especially in providing pharmaceuticals such as protective personal equipment or PPE, oxygen, medical device, and also medicine. Especially for the donation medicine, the product should be checked for the quality and also the legality. Innovation for the pharmacist, especially in delivering the medication, is very important during this era of COVID-19 pandemic, like using the telemedicine, the postage delivery, drive-through, or other kind of innovation. One of other important role pharmacists also educate people to know the correct information for the commodity, like how to use the pass, which one is the right news and which one is the false. And that's one of the role of pharmacists in COVID-19 pandemic. Okay. Ladies and gentlemen, we have come to the end of our discussion today, the role of pharmacists during COVID-19 pandemic. Before we end our webinar today, I will remind some important things. First, after the closing, all of the participants need to fill the evaluation form for the webinar that will be provided by the committee. The second, after the closing, for all of the participants, please do not forget to take the quiz for the post-test, because the quiz will be as a requirement for getting the SKP credit for the certificate from Ikatan Apoteker Indonesia. You will be given 2 times attempt to opportunity to do the quiz. The electronic certificate will be given for the participant who finish the post-test with minimum score 80%. and also join webinar from Zoom application only. The certificate later will be given around 1 week after the event through webinar today. On behalf of all of the committee, I would like to express my utmost gratitude to all of distinguished guests, speakers, panelists, and also all of the participants for making this event successful. And I would also like to apologize for the mistakes and obstacles during this webinar. This event is one of continuing pharmacy education activity held by CPE Faculty of Pharmacy Universitas Indonesia. So later on, there would be many other events that would be held by Faculty of Pharmacy Indonesia. Thank you very much and see you on the next event. Wassalamualaikum warahmatullahi wabarakatuh. Good afternoon, everybody. Okay,
thank you everybody.
Thank you very much for the speakers and also the panelists. And maybe for the committee, would you please explain how to do the poster? For the panelists.
Terima kasih. Seluruh panelis, terima kasih sudah ikut webinar ini.
For the participant, you can check the on the chat room. So just